everyone, and welcome to the pre-seminar. Basically, what I'd like to do is just say thank you for everyone for attending the pre-seminar. Just a little bit of information about the pre-seminar. Pre-seminar is sponsored by AB Vista. And for any of you who haven't had any food or lunch or anything, there's still food available out the back, so you're quite welcome to go out and take food and bring it in as you wish. Basically, I'm just going to introduce our two speakers for the pre-seminar. We've got Dr. Ric Grummer, and we also have Dr. Nicola Walker from AB Vista. Ric, most of you probably have heard of Ric Grummer. He's quite well known in the field of research. Up until 2010, he was a professor of dairy science at Madison and Wisconsin University. After that, he is now the research or ruminant research director for the Balchem Corporation. And basically, he's peer-reviewed. He's written over 100 peer-reviewed papers in research. So very well established, very well known, very eminent researcher, and there isn't much that he doesn't know in the area of transition cow management and metabolic stress for dairy cows. So today, Ric, as you can see from the title, is going to talk on strategies to help metabolic stress in freshly calved cows. So just like to hand over to Ric. Thank you.
Thanks, Derek. It's a pleasure to be here today. I actually spoke at this conference, and we were just trying to figure it out. I know it was more than 3 years ago because it was when I was with the University of Wisconsin. But now I have gotten old and gray and retired from the university and decided to keep myself busy in another capacity. So I've been with Balchem now for about 3 years. Today we're going to talk about metabolic stress in transition cows. So I thought we would start out with a definition of what metabolic stress is. I'm not so sure there is a definition, so this is just one person's thought. But I think of it as abrupt shifts in metabolism that are created either by a nutritional or a physiological change in the animal. So this could be due to changes in feeding programs, changes in the environment, heat stress, environmental situations, crowding. What I will spend most of the time today talking about is the stress that occurs around parturition and the initiation of lactation. Parturition. When I think of parturition, the first thing that I think about is the hormonal changes that occur in the animal as she's preparing to have that calf, as she's preparing to initiate lactation. And these hormonal changes, such as changes in growth hormone, insulin, cortisol, epinephrine, etc., changes in some of the steroid hormones, the bottom line is they're preparing the animal for calving and parturition, but they do cause an abrupt change in the cow's metabolism. The other thing I think about when I think about parturition, other than the hormonal changes, are the changes in feed intake that occur in these animals. As they approach calving, on average, they will decrease about 30 to 35% in feed intake. And then after calving, again, they go through a dramatic increase in feed. So that's another quite rapidly changing situation for the cow as well. When the cow begins to lactate, she has a shift in her priorities. She's all of a sudden shifting nutrient to support lactation. Because of that, there's a big demand. She can't simply eat enough, so unfortunately she goes into negative nutrient balances, and because of those negative nutrient balances, she relies on her body reserves, whether it be amino acids, fatty acids, etc., to support lactation. I spent most of my career studying metabolic stress as it associates with fat mobilization from adipose tissue. This is a diagram that you've all seen in one shape, fashion or another, but this is basically as body fat. Because of the endocrine changes that occur, she will have this release of energy. The fat stores are converted to glycerol and NEFA. The NEFA enter into the bloodstream. Once they're into the bloodstream, we know about 25 to 30% of those NEFA will be taken up by the liver. Basically, it's a function of blood flow. The liver takes up about 25 to 30% of the blood flow or cardiac output, and so it's pretty much proportional to that. Ideally, those fatty acids or non-esteric fatty acids are taken up. The first priority of the cow is to oxidize those fatty acids to CO2. She does that as a way to get energy from those NEFA. But when the cow has a sudden influx of NEFA into the liver, she can't always consume all of those NEFA by complete oxidation to CO2, so consequently we get some of those NEFAs being converted to triglyceride. Ideally, we'd like to have those triglycerides exported from the liver as a very low density lipoprotein. But then occasionally, again, because of the high influx of NEFA, some of that triglyceride gets stored as fat. And sort of another overflow pathway would be not complete oxidation to CO2, but would be partial oxidation to ketone bodies such as beta-hydroxybutyrate. Ideally, what we would like to get is these NEFAs, though, to eventually be exported as a lipoprotein being made available to that mammary gland, where they can be used as an energy source or they can be used to support lactation. Because that's why she's mobilizing fat. She's mobilizing fat to support lactation. So let's go over this in a little bit more detail. This is an oldie moldy from our laboratory back in the early 90s, in which we were taking frequent blood samples around the time of calving. Here are your NEFAs in blood. And again, we use NEFAs really as a proxy for the amount of fatty acids that are being mobilized from adipose tissue. You can see that as she approaches calving, they increase slightly. Again, this is probably related to that decrease in feed intake that occurs as the cow approaches calving. Then you go through a tremendous surge or a spike in NEFA at calving time. And this is normal, all right? This is a consequence of those hormonal changes we were talking about. And it's very common for these animals to go through a 5 to 7-fold increase in NEFA concentration in blood. And it's pretty non-negotiable. There's not a whole lot you can do to modify that. It's just part of the biological process of having a calf and initiating lactation. After calving, NEFAs stay elevated. We get through that big surge, NEFAs stay elevated, higher than what they were in the far-off dry period because, again, she can't consume enough feed. So she's mobilizing fatty acids to support lactation. This is some of Chris Reynolds' work that he's done at Reading University, monitoring blood flow. Besides NEFA concentration, blood flow is also a determinant of how many fatty acids reach the liver, and you can see it's pretty clear cut. Here's the dry cow at 19 and 9 days before calving, and then that early lactation cow. That blood flow goes up 2-fold as that cow adapts from a non-lactating state to a lactating state. So you've got an increase in NEFA concentration, you have an increase in blood flow. This is Chris Reynolds' work showing fatty acid or NEFA uptake by the liver. And it's pretty amazing. This cow is at about 100 grams of fatty acid uptake per day as a dry cow. And all of a sudden, on that day of calving, when she's going through that surge in NEFA, she goes from 100 up to 1,300 grams of fatty acid uptake. I think that qualifies as metabolic stress, going basically overnight from 100 to 1,300 grams, a 13-fold increase. And by comparison, we know that liver, as it goes from the dry to the lactating state, goes through about a 20% increase in fatty acid oxidation. So you can see that fatty acid oxidation cannot account for all that extra NEFA that is coming to the liver. So again, this is an old data set from our lab showing what happens to liver triglyceride or liver fat as that cow transitions from the dry period to the lactating state. And it's not surprising that the period of most rapid accumulation of fat in the liver occurs when that cow is going through that tremendous surge in NEFA, right? And the liver just can't keep up through oxidation, so much of that fatty acid gets converted to triglyceride. Not enough of it can get exported as fat, so she starts to develop fatty liver. After that, because the NEFA elevation continues, granted it comes down, it's not as high as it was at the surge, the cow continues to accumulate fat in the liver. So, fatty liver happens pretty often. This is a summary of 5 different studies done in different countries, done under different management conditions, different feeding schemes, different genetic basis for the cattle, but they are all in agreement, and that agreement is that about 1 out of every 2 cows will develop moderate to severe fatty liver, as defined as 5% on a wet weight basis. And that's not my definition, that's the veterinary community's definition. 5% or more on a wet weight basis is moderate to severe fatty liver. So we got basically 1 out of every 2 cows then that because of this metabolic stress of fatty acid mobilization will experience fatty liver. Subclinical ketosis. I don't know whether that's being talked about much over here. It certainly is in the U.S. because we've had some of our predominant veterinary schools get into this topic recently. Recently there was a study that was joint between the University of Wisconsin and Cornell University studying mainly bigger, more progressive dairies, but reporting back that the incidence of subclinical ketosis about 40.3% in this study, all right? And that's a window of between 3 to 16 days postpartum, and that's using a cutoff of about 1.2 millimole of BHBA per liter. Associated with that, they came up with about a 3.4% milk loss, 19 times greater risk of DA, 3 times greater chance of removal from the herd, and in U.S. terms, they came up with a value of about $67 per case of subclinical ketosis. So again, this is due to this metabolic stress. The liver can't completely oxidize all these fatty acids, so fatty liver and certainly subclinical ketosis is a likely result. So what I'd like to talk about next is, okay, now that we know that it happens, now that we know that it's in essence a part of the normal biology of the cow, what can we do to help the animal cope with that? And really it comes down to 2 strategies. It's pretty simple. One is you decrease the amount of fat that's mobilized from the adipose tissue. In other words, if you're saying, boy, that cow's mobilizing much too much fat from the adipose tissue, let's do something to block it so we don't have as much NEFA being delivered to that liver. So that's one strategy. The second strategy is really sort of working at it from a different angle. That is saying, well, let the cow mobilize the fat, but is there anything we can do to help this liver, once that fat has arrived, get exported as part of a low-density lipoprotein? In other words, we'll try to package that NEFA back into triglyceride, and rather than having it be stored, have more of that being partitioned out and exported as a lipoprotein, where it then can be utilized by the mammary gland, again, to support lactation. So let's go over these different strategies. Let's start with this idea of reducing mobilization of fat off of the back of the cow. We can kind of subdivide that then into 2 categories. One would be to do something to the basal diet that acts to help reduce the amount of fat that's mobilized from the back fat. In other words, is there something I can do when I'm formulating the diet? The other would be to come in with some sort of a supplement or a feed additive that inhibits adipose tissue mobilization, or conversely, think about in terms of maybe we'll go with that opposite strategy of having something that directly affects the liver and helps to process the fatty acids out of the liver. So that might be another possibility. So let's talk about the alteration of the basal diet. There is one methodology or strategy that has been used in the recent, I'd say about 10 years now, and that is what's sometimes referred to as the Goldilocks diet. And the Goldilocks diet essentially refers to feeding that dry cow energy at just the right level. Not too high, not too energy dense, or not too low. Jim Drakely at the University of Illinois has conducted the vast majority of this research, and there is no question that his data shows conclusively that, yep, you can lower non-esterified fatty acids in blood, you can lower liver triglyceride and beta-hydroxybutyrate. The mechanism by which this strategy of feeding the cow just right isn't known, but it's speculated that perhaps we are allowing the cow to be less diabetic-like, if you will, or cows become less insulin resistant. One of the things that happens during this hormonal changes that we talked about is cows become insulin resistant. Insulin is a hormone that basically suppresses fatty acid mobilization. So if cows become less resistant, that means that the hormone is working better and it's doing a better job at suppressing fatty acid mobilization. So it's probably the mechanism by which it's working with. They're accumulating some evidence that points that way. Again, I think it's a reasonable strategy. The only concern I have is that the long-term feeding of low-energy diets may result in lost milk production. This is actually the last transition cow study that I did when I was at the University of Wisconsin. We fed the controlled energy diet versus a higher energy diet during the far-off dry period. That was from -8 to -3 weeks prepartum. And when we went to that lower energy diet, we lost about 5.4 kilograms of milk the following lactation, and that was statistically significant. This is Drakely's most recent study that he's published in the Journal of Dairy Science. Here's the level of energy. He fed 5.0 versus 6.82, and in the multi-parous cows only, they lost about 9.3 kilograms of fat-corrected milk in that study. Now, one of the speculations is maybe they went a little bit too low in this study, but that's the one caveat that I would report with these diets, is there may be some lost milk the next lactation. And to a certain extent, that may fit. If you're suppressing fatty acid mobilization, which is an event that's taking place to support lactation, you might see a reduction. All right, supplements that might reduce fatty acid mobilization. Niacin is a very potent compound that can be fed to cows. Free niacin is great in the rumen, but if you protect it from ruminal degradation, niacin will actually directly affect adipose tissue and, in fact, inhibit lipolysis. Chromium's one that's being talked about now in the United States, came on the market several years ago. The purported mechanism is that perhaps it makes this cow more insulin sensitive. In other words, maybe causes that hormone to suppress fatty acid mobilization more effectively. Propylene glycol is one that has been looked at and worked with for years and years and years, and basically propylene glycol also works by eliciting an insulin response. But I want to get back to this concept of inhibiting fatty acid mobilization as a strategy. This is actually, I went back and read one of my review papers. This is 20 years ago now. But in there I wrote, several strategies for the prevention of fatty liver and ketosis have been proposed, but present limitations in the knowledge of hepatic fatty acid metabolism preclude effective implementation of some strategies. For example, increased rate of hepatic VLDL triglyceride export would be desirable, but until the mechanism limiting export is known, rapid progress in developing strategies will be relatively difficult. I go on to say, for the present, management of fatty acid mobilization during the peri-Parturition time may provide a more feasible approach. Again, that was 20 years ago. And so one of the things that I'm going to talk to you today about is, I think now we've unleashed one of the keys of why lipoprotein export out of the liver of ruminants is limited. But I also like this quote. This is from John Newbold, and this was at a presentation he made at the Nottingham Feed Conference back in, I think it was 2004, published in the book in 2005. He writes, nutritional restriction to adipose tissue mobilization might be necessary, but there's a philosophical problem. We have selected cows that have increased reliance on mobilized body reserves as a source of nutrients for milk production. The farmer has paid the geneticist for this. Are we now going to ask him to pay the nutritionist to work in the opposite direction? We have our priorities wrong. We should explore what can be done to help the liver deal with the mobilized fatty acids before considering whether we need to reduce the amount of fatty acids supplied to the liver. So let's talk about the strategy of assisting the liver in exporting fat. Again, when that NEFA comes to that adipose tissue, some of it's going to be oxidized, but when we have an overflow situation, that NEFA is reesterified to triglyceride, and ideally we'd like to have that triglyceride again be exported as part of a very low density lipoprotein. Before that can happen, though, that triglyceride has to be packaged with protein, cholesterol, cholesterol ester, and also phosphatidylcholine. And research in non-ruminant species has shown, using many different techniques, many different models, experimental approaches, that if phosphatidylcholine is limiting, this process breaks down and the rate of VLDL export out of the liver is impaired. And what I'm going to propose to you today is that in ruminant animals, the choline that is needed for the synthesis of phosphatidylcholine is in fact limiting, and that is why we have such inefficient processing of NEFA out of the liver as part of a very low density lipoprotein. So this again is about a 20-year-old review article that was written by Rich Erdman, but he took up the topic of choline at that point in time, and he said, well, that average dairy cow is probably going to have about 30 grams of its choline in the diet. Just normal feed ingredients will be about 30 grams. But even at that time, we knew that the ruminant animal extensively degrades the choline in the diet. The rumen microorganisms chew it up. They break it down. Consequently, because there's little additional contribution from the ruminal microorganisms, you only get about 1 gram of choline leaving to the intestine of that cow per day. And at that time, and we still don't actually know the exact grams of choline that are required, he said, well, let's just extrapolate from the pig. He said, let's just pretend the cow is a big lactating sow. And he said, well, a lactating sow of that size would need about 30 to 50 grams per day. But yet, the animal's only getting 1 gram per day. So that sounds like a pretty big deficiency. And I'm not going to come here to argue that our cows are deficient by 30 grams or 50 grams of choline per day. Clearly, cows have evolved with very little choline being in the lower gut, so they're probably better than a sow at endogenously synthesizing phosphatidylcholine. All right? they are probably better than a sow. But the question is, do they synthesize enough? Well, one of the things that I also like to point out is Rich Erdman said, well, maybe we can just overwhelm the bugs. Maybe we can just feed much, much more free choline and maybe force some of it through. This is an experiment where he fed a control diet supplemented with either 178 or 326 grams of free choline, but when he measured the amount of choline leaving the duodenum, 1.2, 1.3, well, he finally bumped it up about an extra gram. All right? So you can't overwhelm the bugs. If you're going to provide the choline, it has to be in a form that is protected from ruminal degradation. So this is an experiment that we did in our laboratory that basically was what I call a proof of principle experiment. So in this experiment, we were trying to see whether choline had a role in preventing fatty liver. We concocted a very simple model. We took far-off dry cows, and we feed restricted them for 10 days. And we feed restricted them to 30% of their energy requirement. We did that to trigger lipolysis, to trigger fat mobilization off the back of these animals. During that 10-day period, they either got a control diet or they got a diet that was supplemented with Reassure, our ruminally protected choline, and we fed that at the 60 grams of the protected choline product per day. All right, 10 days. Then we went in and we biopsied these animals and measured the amount of fat in the liver. These were the control animals. You can see we got them to actually a fairly high level of liver fat, similar to what a cow around calving time might experience. And through the supplementation, we reduced that in about half. So, proof of principle. If you have a cow with high rates of lipolysis, you feed a protected choline, it will prevent fatty liver. What about transition cows? We've done several experiments now. This is the most recent that was published, and boy, time flies. This is 2011. But I show this one. This was because it was done in the Netherlands. All right, sometimes people like it a little closer to home, right? So done in the Netherlands, feeding again the ruminally protected choline from 3 weeks pre-calving to 6 weeks post-calving. And you can see at 1 week and again at 4 weeks after calving, there was a significant reduction in the amount of fat in the liver of these cows that were fed ruminally protected choline. So it really all fits, because if you go back to the non-ruminant literature, what's the classic deficiency symptom for choline? Fatty liver. So it's pretty clear that these cows around the calving time, when they have this high influx of NEFA, they simply don't have enough choline to help the liver deal with all the fat. Okay, the last topic I want to discuss is so what? Cows get fat in the liver. Is that a big deal? Or is there something relevant as far as the economics to the dairy producer? I'm going to start out with studies looking at feeding ruminally protected choline on reproduction. This is looking at first service conception rate, either in the blue bars, a control, or the red bars, feeding the Reassure ruminally protected choline. Okay, this is a university study, and, you know, a big increase in conception rate, basically way too big to believe. Done with 62 animals, all right, it was a small study. But that increase, amazingly, was significant. Here's another university study done at UC Davis. Now we've got about 180 cows per treatment. Perhaps a more realistic bump in conception rate. This was significant at the 0.2 level, though, so it wasn't quite statistically significant. The 4 studies in the middle are studies that Bulchem has done on commercial dairy farms, all suggesting perhaps an improvement in first service conception rate. But this is sort of preliminary data, but I think there is evidence to suggest there may be an effect. There's actually a quite deep literature base showing relationships between fatty liver and poor reproductive performance. All right, we mentioned that fatty liver and ketosis are related. This again is a The California study, when Jose Santos was there, 180 cows per treatment. They looked at clinical ketosis. There was a significant reduction when feeding the protected choline. This is relapse of those cows that were clinically ketotic, and that relapse rate was reduced. This is subclinical, and at 1 and 14 days. This is done via a blood measurement, and you can see the reduction here, 0.0 level at 1 day, 0.35 at 14 days. This was both multi and primiparous cows. There was a significant parity effect here. The results were most dramatic for the multiparous cows, less dramatic for the primiparous cows. No effects on retained placenta, metritis, or DA. Mastitis at 0.06. There's a reduction in mastitis. When the group lumped all of these together with the clinical and looked at all disorders, there was a significant reduction that was highly significant. To a portion of these cows, they took liver biopsies and separated cows into either having fatty liver or hepatic lipidosis using that 5% cutoff. And you can see the incidence of hepatic lipidosis or fatty liver was reduced from 40 down to about 14%. All right, lastly, I want to show you, I recently did a meta-analysis. There are now 13 transition cow studies that have been done looking at the effects of feeding ruminally protected choline. So this is a statistical procedure by which we pool all 13 of those studies together. Before calving, there was no significant effect on feed intake, but after calving, cows that are fed ruminally protected choline had an increase of about 0.74 kilograms of dry matter per day. The p-value on that was 0.004, so highly statistically significant. This is milk yield again, and this is an average increase of about 2.2 kilograms across these 13 transition cow trials. The p-value here was less than 0.0001. In statistical terms, that means that if you conclude that there was a treatment effect here, that your chances of being incorrect are less than 1 in 10,000. So that tells you that you can be very highly confident in these results. Actually, when I saw that p-value, I went to my statistician at the UW and I said, I don't know if I think maybe we did something wrong. We went through the statistical model, and he said, no, it's okay. He says, plot out the data. And these are the 13 individual trials plotted out. The stars simply say that on an individual trial basis, whether they reported a significant effect at p-value of 0.15 or less, 7 of the 13 trials did, okay? But where you get power in the meta-analysis is now you've pooled all these studies together, all right? Which gives you much more statistical power, and the consistency in response, a positive response across these studies, is what in fact leads to that p-value of 0.0001. Energy-corrected milk, there was no significant effect on fat percent or protein percent. Both of them increased slightly, so overall, when we expressed as energy-corrected milk, the increase was slightly larger than fluid milk at 2.68. So with that, I'm just going to summarize that metabolic stress is in fact associated with parturition and lactation. It's unavoidable, and one of the messages I'd like to leave you is it's not always have to be deemed as undesirable. In other words, fatty acid mobilization is being done for a purpose, and that is it's a purpose to support lactation. Methods to moderate this increase in fatty acid mobilization include altering the diet or adding supplements to minimize mobilization, but that fights that natural mechanism to support lactation. Choline works a little bit differently in that it supports lactation by allowing the mobilization of fat and then allowing the liver to be more effective with dealing with it. choline in the 2001 NRC was not listed as an essential nutrient. And if you read the text of the NRC point blank says, we're not making a judgment on it because there isn't sufficient research at this point in time. Those 13 studies that I showed you, all done at universities, have all been produced and published since the 2001 NRC. I think we now have sufficient evidence to suggest and to argue that choline, in fact, is an essential nutrient that is deficient in transition cows, and that through its supplementation we can increase cow health and performance. So with that, Derek, I would be glad if you allow or have enough time to open it up for some questions.
If you just wait a minute, I'll bring you a microphone. So anybody who wants to ask a question, if they raise their hand, and I'll bring them a microphone and everybody can hear.
Stephen Bendel, how long should we feed this choline to these cows before calving? Because my cows are in one group and I feed the same diet for 60 days.
Yeah. Well, the recommendation that we have for choline supplementation is from 21 days prepartum to 21 days postpartum. All right? The 21 days prepartum is really a way to make sure that the cow has choline in its system. In other words, that it's sort of in a steady state in the amount that it absorbs each day to be able to handle that surge in NEFA. All right? So does it really have to be fed for 21 days? Well, no, not strictly. If we knew exactly when the cow was going to calve, we could probably come in 3, 4, 5 days before calving and go ahead and feed it, and we'd probably be fine. The recommendation really takes into account that error in the fact that we don't know when every cow is going to calve. Probably 90% of them will be within 10 days of that. So you could probably back up and say 14. Why do we say 21? I think that originally, that was made long before I came with the company. I think that's because it fit with a sort of traditional pre-fresh group, 21-day pre-fresh group, etc. So the short answer is if you knew when the animal was going to calve, you could probably feed 4 or 5 days. If you don't know, you better give yourself some insurance beyond that. The recommendation to feed after calving is simply to get the cow through that period of negative energy balance or most severe negative energy balance when, again, NEFAs are still high.
Is there any benefit in feeding just pre-calving if it isn't practical to feed post-calving?
Great question. One that I can't answer very well because we really haven't run that experiment. In other words, we haven't run the experiment where we've fed either none at all, pre-only, post-only, or pre and post. So we don't have that data. I tell people because of management situations, feeding groups, whatever, if you can only feed pre, then by all means do it, because then when that animal calves, you still should have choline circulating in that animal, so you're going to get her through that period in which that NEFA peak is the greatest, and that period in which overnight that fatty acid uptake by the liver goes up about 13-fold. So if one can only feed it pre, absolutely feed it pre.
Is there any synergism in feeding protected choline together with, say, propylene glycol or something like glycerol or glycerin for that matter?
Yeah, great question. I think there very well can be. In other words, because the choline is really being targeted towards a liver as a site of action, whereas something like propylene glycol or glycerol is being targeted at adipose tissue, that I think there is the opportunity for there to be synergies there. Now, has that been tested? Not to my knowledge. Okay, so I can't stand up here in front of you and say absolutely that there is one. But certainly from the biology of it, it would be, I think, easy to suggest that there could be some sort of an additive effect. Synergistic effect, I don't know, but additive, I think, would probably be a better word to describe it. So I tell people all the time, I said, if you want to bring in something like propylene glycol or niacin or something to that, and maybe kind of get a sort of a double whammy and be, I mean, I have to freely admit, when we look at all of our studies, we reduce liver triglyceride 35 to 50%. We don't eliminate it, okay? So if somebody wants to come in and try an approach such as that, I'm all for it. The only caveat that I will give is that I like to see those anti-lipolytic approaches stop at calving, all right? And again, it's philosophical. It goes back to John Newbold's quote. You know, after she's calved, you know, wow, let's support lactation and let's have her mobilize the fatty acids. And anytime you're doing something like that, you're suppressing. And we've got data, for example, with our protected niacin product where it can reduce fat in the liver, but one of the things we see is a reduction in energy-corrected milk output because we're suppressing lipolysis. We're lowering the NEFA. Yeah.
Is choline found? Excuse me. Is choline found naturally in the environment in any forages or feeds?
Yeah. Again, sort of when Rich Erdman did his exercise, he was kind of going with a traditional, you know, corn silage, alfalfa, corn, soybean type diet, and he came up with around 30 grams. There are some feeds that are naturally higher in choline than others. The point being, though, is that because the rumen microorganisms are so effective at degrading it, I really don't think it matters really what level of choline you're feeding. That rumen system is just so efficient.
First of all, thank you for an excellent presentation. I noticed on one of your slides, later in lactation, about 21 days, the hepatic lipidosis was reversed in cows that have been fed the protected product, the protected choline. I just wondered if that effect was significant, and was there ever any evidence that continuing to feed protected choline later into lactation was detrimental to liver function? And the reason I ask, it's a common practice in Europe for the fresh pen to actually contain cows right up to 50 and sometimes 60 days in milk.
Yeah. I'm not able to go back. The slide you were talking about was the Wageningen research. So the reduction in liver fat was at 1 and 4 weeks after calving. At 6 weeks after calving, I think what you're referring to is those bars were inverted. Keep in mind two things. At 6 weeks after calving, there was no treatment effects. So statistically, there was no difference between treatments. The other thing is, at 6 weeks in time, that liver fat had come back down to about where it was 3 weeks prepartum. And that's because that animal is getting back into a positive energy balance, and this assault of NEFAs has been modified and moderated. So I would not take that data to suggest that there was a detrimental effect, because again, it wasn't a significant difference. In the meta-analysis, in which we had 13 studies, there were basically studies that went from feeding anywhere. One study stopped at calving, the other 12 all fed into lactation, but all 12 fed for varying lengths of time. Anywhere from, I think it was a minimum of 2 weeks up to the longest study fed for 120 days. When I did that analysis, I looked at duration of feeding. I looked at studies in which feeding was up to 30 days or greater than 30 days, and when I looked at the milk response, there was no difference, okay? So it seems like from that analysis anyway, there doesn't seem to be any extra benefit from feeding longer than 30 days. Do I think there's a detrimental effect? Absolutely not. These cows simply aren't getting enough choline in there to be toxic.
Rick. We've got a question in Italian, so can you repeat the question?
There's an Italian participant that has a question for you.
Oh, okay.
No, I will tell the question to you. And then you
Okay.
Okay. It says it's very fashionable these days to say that glycerol causes problems in the post-coughing period. So do you think that adding maltodextrins to choline can have the same effect?
Glycerol.
That's what he said.
Okay. I'll repeat the question. I think the interpretation was something like it's very fashionable to say that glycerol has negative effects during lactation,
Post-calving.
post-calving, and therefore is there...
Do you think that adding maltodextrins to choline can give the same effects as glycerol without causing negative effects?
So can multidextrins have some of the same effects of glycerol? Maltodextrin. Dextrin. For some reason I thought it was maltodextrans, but I don't know what that is. Well, first of all, I didn't know that it was fashionable to say that glycerol was detrimental after lactation, so I guess I'm not going to be the best person to answer the question. To my knowledge, I don't know what the negative effects of glycerol are post-calving, and boy, you're talking about a literature base that I'm not familiar with. Yeah, sorry, can't answer. Maltodextrins. Does anybody can explain what that is to me? Maltodextrins. Destrins, those.
Okay, we've got another question.
Get to something I know something about.
I also like to echo the thanks, Rick. It's good to put a face to a name. Quick one, is choline, bypass choline commercially available in the States and or Europe? And at what level do you feed it? And there's a third string to my question. There's been a recent release of recent license of monensin in this country for use in prevention of ketosis, and I presume that works in a similar way to propylene glycol. Do you see you're trying to discourage, correct me if I'm wrong, products that reduce mobilization post-calving? What have you got to say about use of choline and monensin together?
Okay. Good question. I think the first part of the question is whether protected choline is available in the U.S. and Europe. Was that the question? Yeah. Yes, it is. So, for example, we sell our product, in Europe and the U.S., and we have competitors that also sell products both in Europe and the U.S. So, protected choline is available. The second part of the question is monensin. So on the slide where I had inhibitors of lipolysis, I had things like niacin, I think propylene glycol, chromium, I don't know if I had insulin up there, insulin injections. Anyway, monensin, you're right. If you take a look at the research, monensin will lower NEFA and lower ketones. There have been 2 studies that I know where they've also done liver biopsies, and there hasn't been an effect on liver fat in those 2 studies. But overall, the literature, I would agree 100%, lower NEFA and lower beta-hydroxybutyrate. But I set aside monensin as being a little bit different than those other compounds. For example, niacin. I mean, niacin is working directly on adipose tissue, all right? Monensin's a little bit different. Monensin is probably operating through improving feed efficiency. And I will never condemn improving feed efficiency, okay? Because basically what you're doing there is you're getting more bang for every bite of food that the cow eats. And if that's the way that NEFA are being reduced, because you're getting more bang for your buck, I don't have any problem with that at all. So I don't... You're right, it is sort of in the same category, but because it works by actually enhancing the amount of energy that the cow gets out of the feed, I really have no problems with monensin at all. And in fact, you know, we really need, from our company perspective, I think we'd like to see research done with monensin and choline, and the reason for that is because monensin allows for greater propionate production in the rumen. I didn't go over it today, but one of the things that we know about cows with fat in the liver, they are less efficient at converting propionate to glucose. So again, we think there could be an additive and in fact synergistic effect if we can get more propionate from the monensin, and then we have a liver that's more effective at converting that propionate to glucose. You know, that could actually be kind of a win-win situation. So great question, and I probably should have clarified that. And that I don't really put monensin in the same camp as the other compounds that are really kind of targeted directly at let's stop adipose tissue. You know, so good question.
So there was the additional question about the feed rate of the product, the choline.
The feeding rate.
How many grams a day? Yeah, the bypass choline, how many grams a day you feed?
Okay, so good question. You know, this was obviously not more of an applied feeding type talk, but what we recommend is that the choline should be 15 grams. Our product, though, is fed at a rate of 60 grams because it's basically 25% choline. So that gets confusing for a lot of people. So they'll see those different numbers. So you gotta keep it straight, whether it's the recommendation is for choline or whether it's a recommendation for choline and the carrier or the encapsulate. So 15 versus 60.
Okay, thank you very much, Rick. There's a